One of the questions for us was what type of machinery could be put in place to enable the federal government to fulfill more of a partnering and facilitation role to help ease the process of moving provincial and territorial healthcare towards a more integrated and sustainable basis. And the question has some real acuity for the federal government because there are real challenges, of course, with First Nations healthcare, and it's responsible for a large part of that. So we felt that there needed to be some rethinking of the machinery, and the pan-Canadian healthcare organizations that currently exist have won a lot of positive reviews. There's always criticism, of course, but they've won positive reviews for being neutral terrain where provinces and territories can come together with stakeholders and the federal government to collaborate. And when you look at their record, Canadian Institute for Healthcare Information, Canadian Foundation for Healthcare Improvement, Canadian Patient Safety Institute, Canada Health Infoway, among others, these are entities that indicate that the federal government can play a role of facilitating change, gathering the information we need to make change and to make healthcare better for all Canadians. So that led us to the view there should be what I guess you could call an innovation Switzerland, an arm's length body consolidating several of those agencies that would have the scale to really respond to great ideas from across Canada. Coalitions of the willing. Could be 2 or 3 provinces working with a set of stakeholders, could be some professional associations that had a proposal for paying health professionals in a different way that would reward team care or unlock value, many possibilities. But the point is to have some entity that could respond to those ideas to help frame them, scale them, evaluate them, make them sustainable. So that led us to the view that if we had an innovation Switzerland, it had better have a Swiss bank account. And the idea there was none of this comes cheap. Most provinces and territories are struggling to fund healthcare today. They've got lots on their plates. And so to help ease that change process, to make sure that you are able to move along the necessary implementation of great ideas, of changes in policy or changes in practice, having an innovation fund seemed to be a very good idea. Indeed, many stakeholders in their compelling submissions to us argued for just those 2 things, an innovation center and an innovation fund. So we had very little difficulty deciding to respond. I suppose I should deal with 2 other issues. One is governance and the other is the price tag. I guess that matters. Governance should be arm's length, we thought. It had to be credible people who would be trusted by healthcare stakeholders and by the provinces and territories as well as the federal government. We had to have good governance of this entity. The second thing was that any spending, any innovation fund, had to be governed carefully with money flowing according to milestones, according to impact. There should be some allowance for failed projects, of course. That happens if you're innovating. But what you really wanted to see happen was careful spending to make a difference. These are tax dollars, after all. So with that proviso, we then had to scale what the end state should be. What would be the target amount? And we, after some benchmarking, decided that $1 billion per annum in steady state would be a reasonable number that could really make a difference if deployed intelligently in partnership with this new agency. And to put that in context, remember healthcare in this country spends $220 billion per annum and rising, albeit a little more slowly than before. So this is not a big percentage of that. Most innovative industries would spend several percentage points on both R&D and innovation and implementation. So 1 billion out of 220 billion, not a lot. But then let's think about the federal government. It's taken the step of containing the growth in transfers to the provinces. Instead of 6% compounded, it will now be scaled to GDP growth, or on the order of 3% per annum if GDP growth is slow. That creates quite a shift. So there is some capacity there. And more generally, if you think about the federal budget, the federal government, all in, spends $280, $290 billion per year. If you take away the debt servicing costs, which seems fair, you're still left in the last budget with $265 billion of program spending. So $1 billion is well under 1/2% of what our government spends in all ways each year.